Everyone, thank you for coming. My name is Dr. Farouk. I am the school director, and it is my pleasure today to present to you our graduating class of 2015, the last class, our evening group, batch number 5. This year we have had 5 batches of 5 group of students, averaging from 10 to 15 students per group, graduate and pass their state exam and have gone on to, find jobs in the community. We have been here for past 6 years. Our weekday and weekend schedules are into their 56, 58 batches, meaning 56, 58 groups of students have come through our weekday and weekend schedules. So we have been around here for a while now, and we are very lucky to have instructors like Terry, RN, who teaches for us and a few other schools in the area. And our students work very hard. It is very difficult for them sometimes to come every day, keep up with the lifestyle that they have, job, kids, and sometimes it becomes quite a challenge to get them through the program, make sure that they are ready for the state exam. Lately, our state exam results have been great. I don't like to beat my own drum, but it's been above 90%, and state average is about 82%. So our school is doing great in the area, meaning preparing the students and making sure that when they take that state exam, they are ready to pass that state exam on the first try. What I'm going to do today is we're going to call each one of the students that have completed the program. They will receive their certificate of completion. We'll have them line up, and that will be an opportunity to take a group photo, after which we do hand out some perfect attendance awards to some of the students that made the effort and did not miss a single day. And then we also hand out high academic achievement awards, and there are a few students that will get special awards for how well they did at the clinical side, meaning the skill set that they have or what they have been able to achieve in the clinical setting. So that's the program, and we will it's a pretty quick ceremony. After we give out the certificates, if any of the students want to address or say anything to the other classmates or to the instructor or to the school, we're open to listen to any positive or negative, because we learn from our mistakes. At that point, I will address the class, give them a little piece of advice before they leave here, and then we'll call it a day. Okay? So without any further ado, I would like to start by presenting the first Certificate of Completion Award to Hugh Dong. Hugh? And then I have Vicky Jones. Christine Flannery. Christine. Let me take a picture. I think we forgot. All right, thank you. And then I have Zen Sophie. Zen? And then I have Naomi. Naomi. Jose Montes. Alright, good. Thank you. Don't be nervous.
Okay.
Miriam Youngs. Miriam? Janelle Stone. I have Jessica Monique. Sarah Pepper. And Derek Waller. Derek. As you can see, these 12 students, or 12 or 13, how many we got? 2, 12, or 6? 12 right now. You know, they started the program a couple of months ago, and as all of you know, we have had our ups and downs. And you know, one of the things that I learned once I entered medicine was that it's not always as it seems. You're gonna have hurdles, you're gonna have things that you gotta overcome on a daily basis, and that's part of medicine that I enjoy the most. It's not the same old thing. Even though we have a patient that might have diabetes, one patient with diabetes versus another could be a completely different picture, or how you deal with that person, or how that person deals with you. So it's a lot of changes that occur on a daily basis, and as a student, as an individual that's working in the medical field, it is very important for us to adapt to the changes and make sure that we take the best that is thrown in our way and take it and use it to our best ability to make sure that we get the best out of it. And the only other word of advice that I would like to give to you guys is, when you're out there taking care of the members and the patients on a daily basis, please treat them as if you would your own family members. Be the advocate that the patient needs you to be. The CNAs, even though it might be a first step, and I see a lot of young folks up here, you know, I hope that you don't stop at CNA. You use this to go up to LVN, RN, or NP, or even a physician. Because education, you can never stop learning, really, and it is one thing that nobody can take away. You can file bankruptcy, lose your house, lose your wife, and all of that, but the education, the stuff that you have learned, nobody can really take away, okay? And just remember, at the end of the day, we have to concentrate on that patient. As long as you have good intentions, even if you make a mistake, own up to your mistakes, so that way you don't get into deeper trouble, okay? And I'm always here for you guys. If you get in trouble, need help, look me up, call me, okay? And I will do my best to help you guys. And I know you guys have a state exam in 2 more days, and the school will be open. You guys are allowed to come and practice. Are we doing a review day?
Not another one, no.
Not another one. Okay, if you guys want to come back and continue to practice in the lab, you are more than welcome to do so. And the only thing I ask of the family members is, you know, in the next couple of days, they'll be probably quite stressed out about the test. If you can, please give them the additional space and time to study for the test, so that way they can succeed on Thursday, because that's the ultimate goal, is to pass that state exam and get their license, so that way they can start working and get into the field. And when you go out there, you know, don't forget to put me down as a reference. I always, I want to see you guys working. So when I visit these facilities, I run into students all the time. So please put me down as a reference, and I give all my students good references, okay? Now, we do have some perfect attendance awards, and I'll just come up and hand them to you guys. The first one who got the perfect attendance award is Christine Flannery. And then I have Sarah. And I have one more, Zen. Hi, Zen. like to give out a perfect attendance award so they can add it to their portfolio, and when they go to apply for a job, it just kind of shows that, you know, that they can commit to something, be there every day, dependable, you know, all those good things. And I say that about everybody regardless, but you know, I want to congratulate all three of you that you stuck it out and made it to every single class, and it shows quite a character. Okay? Congratulations. And now I have a couple of High Academic Achievement Awards. And the first one again is Sarah. I have, the other one is Derek Wheeler. That means that they did very well on their exams and kept an average above 90% throughout the program. And then I have some Clinical Skill Excellence Awards. So when they go out to the clinical site, they're actually working with real patients and they're taking on a full load with the nursing staff there. So anything that that patient needs, feeding, bathing, walking, you know, these individuals, you know, as students are performing all of those activities and helping those patients. And the instructors have recommended that Derek has excellent award, and then Vicky, Jill.
All right.
Those are all the awards I have, and if any of you want to say anything to the classmates, Miss Terry, would you like to say anything?
I'm just so proud of these guys. Everybody is a big award. The patients really benefited from their hard work and hard study. They were there sometimes where no one else was, to give them that hug and to say good night.
Congratulations, guys.
You got me going, Miss Terry.
Oh, I know we're all around.
So, on behalf of, I think this whole time has been a bonding time, I think, because there's only so many of us, and you really get to know each other for the time that you are together. And we're working together as a team in the class when we do our skills, as well as when we're out in the field. And we've seen a lot of things. We've all shared so much, good and bad, about what we've seen and what we've learned. So it touches my heart, and I'm just really thankful that we've had this opportunity. So on behalf of the December 2015 graduating class, CNA class, batch number 5, we would like to share a token of appreciation for Ms. Terry.
Oh my goodness.
Preparing us to be successful CNAs. Thank you for imparting years of wisdom, of knowledge and skills. And I'm sure our class was not one of the easiest ones to start out with. We're a weird group. It was very interesting because the dynamics and the diversity in our class, would you say, was very interesting. I've taken a lot of classes over the decades, but I think this was very interesting. And then talk about adapting to change in our environment. I think Ms. Terry had to adapt to our class, but she did an excellent job and kept us all together, as well as just persevering with each one of us and the little things that we either issues or things that we had going on. So thank you very much, Ms. Terry.
Oh, you're so welcome. You know, you haven't seen the last of me, right? Because on the day of the state exam, I also teach for Grossmont. And my room is number 3. It is right next to the lab. So I will be there at 7 o'clock in the morning to make sure each and every one of you are there, and I'll be there for the whole time.
You're gonna like that gift.
with you.
And your
I'm
HHA
sure.
class.
Okay. But I'll be there for you that day, all the way up to the end. And then later too, maybe.
Thank you very much, Sherry.
You're welcome. Thank you.
It's so wonderful to hear that students have that type of feeling and they've taken away such a good experience. And I appreciate everything that you do for us. Thank you very much.
Thank you.
Does anybody else have anything else to say before we close the day? No? Okay. What I would like to do before we all go away, can we get 2 lines so we can take like a group photo?
Tall and short.
Tall in the back, short in the front, cutest in the front.
Hey.
They're all tall, Doctor.
In heels.
I know, they're all so tall, I feel like a midget.
Take a squat.
This is a good class, oh my goodness.
We can't see what's her name.
Joe, I'm too short. You're taller than I am. I'll squat a little bit.
No. There you want to swap picture with your group?
Yeah?
Yes.
Miss Ray don't get in
Your
pictures.
picture up.
I don't like it. Especially when you put them on the website.
But you know they're good.
My legs are cramping. Very carrot.
God,
Oh, Lord.
just don't put that bedpan in upside down.
Alright, time for graduation picture. Everyone throw your hats, do something crazy. We're woo!
Okay, don't lose my tassels though.
Yeah.
1, 2,
One.
3.
Congratulations.
I'll get my big head in the shot right afterwards.
All right.